Hello everyone, welcome back to my YouTube video channel. This video is gonna be discussing about the technology that I have on hand. This is the DryShield technology, allow a dentist to work by him or herself. As you can see, this is a simple device that is can isolate the patient teeth, especially periodontist kid, young kid. You can isolate the teeth and you can work by yourself. I was doing number 30 and 31 and number 3 occlusal surface and buccal surface of number 30 for filling, composite filling. So the cavity was very minimally small, and so I start drill, and now I've just put the edge, and now I'm rinsing the teeth, and you can see that the DryShield technology really dry the tube and it suck all the saliva and the water away. And so I'm ready to get the bonding apply on this area. And remember, the vacuum actually suck all the air, the moisture out, so you don't need a rubber dam. This is replacing not only the rubber dam, but also eliminate the moisture in the environment here. It worked really well. I just put the bonding in now, so I'm applying another additional bonding on the upper tube number 3 before I hit the light and cure it. And I have some extra I'm just gonna apply on. So you see there's plenty of time for me to do this. I put some air, dry it, and that's where would be just also blow and suck into the suctioning system, the high-speed suctioning system right now. So we are curing this 5 to 10 seconds on each tube, and after that we double cure a little bit more, and just flowable composite on each tube, and we're good to go. So we're starting to do right now is getting myself the flowable composite tip, and pretty easy to be able to work by yourself without a dental assistant, guys. DryShield technology really useful, especially these days. Very hard to find a dental assistant because of due to the shortage of dental staff. So I encourage anyone who want to get on board with the DryShield technology or Isolite technology. You can use one of these technology and work on the patient by yourself. You can actually do a root canal with no problem at all. I've done it before. This is a very evolutionary way of handling the case by yourself, guys, girl. So yeah, I'm just encourage any young dentist, any dentist who struggle with finding dental assistant. Here's the way to go. I put in a bonding and I cure it. I put the flowable, cure it. Now I'm continue curing this right now. Give it me some time, and it's wonderful that you're able to do this by yourself. No other additional help. If you don't want any assistant around, you still can do this. It gives you time, because the nice thing about this is the bite that they give you, the patient. This bite is so soft and the patient love it. They can buy, and sometimes they can buy hard if they want. I'm doing the occlusal number 3 right now, so flowable composite on number 3, and I'm about to hit the light as well. After that, hit the light. Light is curing, and we're just waiting for this wrapping up, and you can see it's just a couple minutes and I get 3 teeth done. Can you imagine that you have dental assistant, you have to ask her or him do this, do that, so much involved. And this one is, if you put everything ready to go on your tray, you can do it by yourself. Again, DryShield technology. You can buy DryShield technology or you can buy Isolite technology. Both are great. Thank you for watching. I hope you like it, and don't forget to subscribe to my channel for more update in dental education and dental technology. If you are a patient, you can ask me a question. If you are a dentist, you can ask me a question. Comment below. Have a great day. Bye bye.